Hello, and thank you for having me come to speak with you. Now it's virtual, but I'd like to share with you some of the work that we're doing with hepatitis B elimination in Sacramento County. My name is Dr. Eric Chak. I am at UC Davis Medical Center. I'm one of the hepatologists there. The principal investigator of this project is Dr. Moon Chen, and the source of funding is Office of Minority Health. So we at UC Davis have partnered with HALO Health and Life Organization. This is one of the Sacramento County clinics, actually very close by UC Davis. This set of clinics is run by a Hmong lawyer whose goal is to serve the community. These are primarily Asian patients that come to this clinic. It is a FQHC lookalike, so it's essentially a safety net clinic. Many of the patients here are underserved and don't have access to healthcare, so they've come to HALO to get the care that they need. So there's a lot of lower income folks, English second language patients as well. This is a multifaceted project that we call END-B. This is short for ending the transmission of hepatitis B from the perinatal period throughout the lifespan. There are a few things that we focus on with END-B. The first is reducing disparities among HALO patients, and what we're doing for that is we've developed a HALO Academy where we're actually training some of the medical assistants at HALO so that they are better equipped with the knowledge to be able to help patients with hepatitis B, smoking, lung cancer, cervical cancer, etc. So it kind of encapsulates a lot of different medical disorders. We are also screening patients for hepatitis B, so both pregnant and non-pregnant patients are being screened. And this is something that once someone comes back positive, we have case navigation. We have a case navigator, Fresnia Vu, who is linking these patients to care after they're found to be positive. And same with pregnant women as well. We're linking them to care, but we're also making sure that they get the proper perinatal care. For example, if their virus level is high enough, they will be started on antiviral therapy to prevent transmission to their baby. All of this acts in conjunction with electronic health system enhancements. So we've developed custom reports, bulk ordering capability, and also an at-risk registry, which we're able to see patients who are at risk, meaning they're Asian or they're from Africa or they're pregnant, but they haven't been tested for hepatitis B. And we're able to use that technology to test patients who need testing. Okay, so what's the workflow? You're either in the OB clinic or you are someone who's high risk as identified by the registry. We order tests for you. This is the standard 3 tests: surface antigen, core antibody, and surface antibody. And these are placed in the electronic medical chart. They're sent to Quest, which is the lab that HALO is using right now. Based on the results, our case navigator, Fresnia, will follow up and determine what needs to be done for you. Additional labs will be ordered to further characterize the hepatitis B. So the standard labs, e-antigen, e-antibody, comprehensive metabolic panel, which includes the hepatic function panel, etc. If you're pregnant, if the patient's pregnant, then we do some additional work. We determine if your viral load is high enough. If it is, then you'll be starting antiviral therapy. And we'll also recommend that the baby gets hepatitis B vaccination starting at birth and hepatitis B immune globulin. So these are all standard of care things, but this is the workflow as described. And we do use this customized registry again to be able to identify patients, which was actually sort of a modification that we did as a result of COVID, because patients weren't coming into the clinic as in high numbers because they were afraid of catching COVID. They were sheltering in place, etc. So we're able to do this electronically, where we can extract the information from the EMR And based on that, we can order a test without you having even to come in to see your doctor. So it was a little bit more efficient in the area of COVID. This is what the registry looks like. So a patient's name is here. Obviously, they're blocked out because of HIPAA privacy reasons. These are the labs that we've ordered for them. So you can really just select each patient and order. And this is the order panel that we have. So surface antibody, antigen, and core antibody. You can select that. And once they're ordered, the medical director, Ian Johnson, will send this off to, and actually order it so that can be sent off to Quest. And our case navigator will communicate to the patient that, hey, you have some labs, please do them at your convenience. So how is this system working? Well, it's doing pretty well. The OB testing has actually been quite stable. I would say year one before COVID, that was the highest. We've never quite reached those numbers since COVID hit. But when you look at the Asian patients that we've tested, that number has increased quite a bit. When you look at year one, where it's 65 the whole year, okay, but since we started doing the registry, okay, this was year two, quarter two, you can start seeing, okay, we've at least rebounded to pre-COVID levels. And then now it's really taken off. In year two, quarter four alone, we tested 192 patients. So 192 patients completed their testing for hepatitis B with that order panel that I showed you. And you can see here that it's quite a high prevalence at Halo. Of the total of 458 patients we tested, 34 were found to be positive. So that's 7.4%. The numbers are higher now because, at the time of this recording, we're out of year two. We're year three, quarter one right now. So we've definitely tested and found some more positives in that time. But you can see that there's a very high prevalence in Halo. Like I said, these are underserved patients. They didn't even know they needed to be tested. But we were able to go in there using our creativity and these programs that we've come up with to be able to outreach and screen these patients. And this is the Care Cascade. This is essentially how you would follow somebody who is surface antigen positive and what happens to them as they move through. For example, if you're surface antigen positive, the next step is you need to be linked to care, meaning you're going to see a hepatologist. The other step is that, or the next step after that is that you're engaged in care. So you're checking your labs as you should, right? This is your e-antigen, e-antibody, viral load, hepatic function panel, etc. Retained in care is seeing your hepatologist twice. And then the third step, or the last step, is antiviral therapy. Typically speaking, 25% of patients should be on antiviral therapy, roughly. So we're pretty close to that. And you can see for the pregnant women, we haven't diagnosed a lot more pregnant patients after the first year. So this number has been very steady. There's only 4 total, but you can look at the non-pregnant people, the high-risk patients. These are the patients who are being tested. So we have 34 that are positive so far at the time of this snapshot. And many of them are being linked to care, engaged, retained in care. Obviously, we want these bars to be all the way to 100%, but in the real world, it's not always possible. We call these patients, we send letters, things like that, but we don't always get a response. So that's what our case navigation is for. So we hope to increase some of these numbers and add more patients who are positive so that they're aware of their disease in the coming year. So this is a model that you could use for hepatitis B elimination. I think in this day and age, when you look at COVID, you really have to take all of your programs, all your programming has to take COVID into account, how to work your way around COVID. Coming from an academic center like UC Davis, I think it's very important to find a community partner. In community, there's going to be a lot more hepatitis B, I think, than an academic center. These are higher risk patients that have not had medical care for much of their life, so they may not have been screened before. They may not have been vaccinated when they were younger. After you find that community partner, you need to collaborate. So work together as a team. You can't just come in and do what you want to do. You need to do what works for both sides and what works for the patients in that particular setting. When you collaborate, you need to use your creative juices and discover new ways to overcome barriers. So, for example, in our case, the registry, I think, was a barrier that, or was a creative solution to COVID and patients not coming into the hospital or to the clinic. And the last thing is continuity. How do we continue to do these things after the program has ended, after the funding is gone? Are the things in place that you can continue or sustain what you're doing for the project? And Halo is starting to do some of those things, actually. So they're doing text messaging to patients now. They're also trying to get a hepatitis B or a phlebotomist so they can test for hepatitis B in the clinic instead of sending them out to Quest. So these are things that are being worked on for the future. So hopefully they'll be able to carry on the torch even after the program has ended at the end of year 3. So thank you very much. I appreciate your time and thanks for having me.